One dental practice. One expert team. One dramatic transformation. This is the ultimate practice makeover.
I felt, a bit despondent and thinking to myself, well, I might have to just sell the practice or give it up and return to working as an employee dentist somewhere.
Ooh, not good. But the good news is Michael's won the Ultimate Practice Makeover. Welcome to the Ultimate Practice Makeover, where we ask the question, with the right help, how fast can you turn a struggling practice into a thriving practice, and what are the steps? In this episode, we're joined by Dr. Jessie Green, talking all about patient retention and case presentation. These things can make a massive difference to Michael's practice. In addition, I'm working with Michael and the team on patient referrals to take them from getting a few ad hoc referrals to implementing a 3-step patient system to get their patient referrals rocketing.
So when we looked at the data, I saw that the retention was actually quite good, and that's great. And then it made me think, what else is going on here? What's the issue? And the issue really is that they've got this group of patients that have been effectively under-serviced for a period of time. There hasn't been consistent diagnosis, there hasn't been a uniformity of treatment planning, and there certainly hasn't been a system for offering that treatment in a way to have it accepted. And so what we did is we looked at these patients, we came up with the clinical philosophy, we thought about how that treatment could be presented really well, really ethically, in the patient's best interests, but also how we could create a system around that so that the patient was more likely to say yes to that treatment. So we've got assets here, and we've got 4 types of assets. So we've got physical assets, intellectual property assets, patients, and of course team assets, and the role of the business owner is to convert those assets to revenue.
So patient retention here at Authentic Dentistry could be better. There's no question about that. If they don't call us, a good system would have us calling them, but I'm confident that it's not happening reliably. So that's certainly an area for improvement.
So with respect to retention, there's 3 really common leaks in a dental practice. The first big leak is the recall system. And the recall system is, I think, one of the most, if not the most important system in the practice. Is where your patients come back and forth routinely. And oftentimes in the busyness of day-to-day dental practice, it gets neglected. So that's the first big leak. The second big leak is cancellations and no-shows not being properly followed up. So we know that when a patient doesn't show up or cancels, they're kind of stepping one foot out of the practice. And when they're not having a close relationship with us, it means they're now more vulnerable to the marketing messages of other businesses. And so we want to keep them tight. And the third big leak is incomplete treatment not being followed up. And for the same reasons, we want to make sure that the treatment is completed so the patients get their outcomes that they're after. But also we know that we want to get them back in and onto that continuing care cycle as well. So if you're suspecting your retention rates might not be up to par, those are the 3 areas I'd look at first: recall system, cancellations and no-shows, and then incomplete treatment. Having great practice software is really important because it is a tool that drives your business. And from a business and reporting point of view, you want to have ease of report. You want to be able to extract data easily, regularly, but equally in a format that is easy to understand and easy to interpret and make good decisions. So unfortunately in this practice, the software that's used is not mainstream. And that means that while some of the clinical functionality is there, the reporting structures are just not. It means that the data we get is hard to understand, it's hard to interpret, it's really hard to make good decisions from. And so, one of the recommendations I would be making would be to consider looking at other software providers that have really good reporting that allow Michael and his team to make informed decisions moving forward.
So the Ultimate Practice Makeover is going really well so far. I'm happy with how things are progressing. It's not too fast. Initially, I was a bit concerned it was going to be this change everything all at once, but it's turned out to be, in manageable pieces. So it's really looking positive. I can't wait to keep going.
We have been working with Michael and Amy, and we have finalised the floor plan. We did some 3D drawings and 3D renders and what the place would look like, so we've got some before and afters. And we've also developed the full construction set. We have also costed up the project, ready to go. So we're at that stage where we just have to find the right time with Michael and his patients to be able to get in here and do the job.
So the design for the practice looks really good. Our plans were to have the reception desk and the waiting room renovated. They've done a really good job with the design. It's quite modern, which is what we're after. I mean, the practice as it is fine, but it's a bit dated. So I guess really they've nailed our main priority, which is to lift it and to modernise it. And so we just want that first impression to be a good one with the patients. And I think, I'm confident it'll work.
Well, we need to schedule the fit out now. We're getting closer to that stage. We need to discuss with Michael and his patients. He might have a holiday where he might go away for 5 days. It might be 10 days for us to come in and do the project. And it's a matter of coordinating and mobilising the trades, getting them all to sign up and ready to go.
Yes, that's the next challenge, right? Trying to get hold of trades and schedule things is a challenge at any time. So we'll see how Martin and the team at MediFit can work that in.
I think in terms of timing, I would think that we would start on a Friday, we'd run it through the weekend, Saturday and Sunday when there's no patients here, we'd work it all through the week, and then even the following Saturday and Sunday if we actually need that. We really need a project timeline to actually govern the trades coming in and out, and we need to get it done as fast as possible. It's not like the block where you've got 1,000 trades in one particular space, so we need to come in and succinctly do the project.
Yeah, so based on the 3D simulation that they service, I'm really looking forward to seeing the result. It'll be nice.
Referrals are such an incredible opportunity for practices, and yet many practices don't have any kind of formalised referral system. If it happens, that's good, but we're not actually doing anything to encourage it. And so what we're doing with Michael and his team is setting up a referral system.
We currently don't have a referral system, but if we could get 5 to 10 extra referrals per month using Angus's system, then that would be outstanding. That's really the best thing you can get is just new patients into the practice.
The main reason that practices don't have more success with this is they simply are afraid to ask. Then simply saying to them, look, we'd love to have more patients like you, it's pumping them up. It's a nice little kind of bonus for them. And in our experience, the worst outcome you're going to get is they just won't refer. But the best outcome is they will, because they say, well, I already like this practice, and I'm very happy to help you out. So over the year, they could potentially see an extra 100, 120 patients. It makes a really big difference.
So the next 12 months is really an exciting time, because as we start to implement these changes, I can see real value to the practice, and whatever challenges come up, I think will be interesting. And to have all the chairs working full time is the goal. So I'm pretty confident we'll get there.
In the next episode, we're doing something special. We're sending Michael to Melbourne to learn about the hottest clinical trend in dentistry.